whatever we do, regardless of whether it's apprenticeships, apprenticeship degree, or traditional pathway, we've got to have work-based learning incorporated. Far too often today in healthcare, we have clinicians come out of a program academically, and they just don't come with enough durable, or as I say, human skills.
Hi, I'm Jeff the Brand Guy.
And I remain Professor James.
And welcome to Job Ready. And we're so grateful to have with us here today, Geoffrey Roche. Welcome, Geoffrey.
Thank you for having me. Excited to be here with you both.
Geoffrey is the inaugural Director of Workforce Development at Siemens North America and Siemens Healthineers North America. And Geoffrey, let's ground our audience. Can you just tell us what you do for Siemens and Siemens Healthineers in a nutshell?
Yeah. So obviously, I have the privilege of leading, as you said, an inaugural function that's really focused on holistically, how does Siemens on the healthcare side of all the work that we do build a sustainable future-ready workforce with hospitals and healthcare systems, obviously, who are which are customers. And it really looks at the full ecosystem of workforce, from K through 12 to higher education to our workforce boards, the philanthropic community, at times even the VC community, startups, and then also, what do we need to do, particularly after we think about somebody on the hospital side, to doing everything possible from a career and talent mobility standpoint. And so I have the privilege of, really serving as a trusted thought partner to the C-suite, and really a thought partner with all aspects of human resources to really study, understand, and put forward guidance on what that looks like and how to do it. And then, certainly be a super connector to help them find different opportunities and get access to, different ways to think about that workforce.
Correct me if I'm wrong. You're known as a heart leader. I've heard that, and it really intrigued me, especially in healthcare workforce development. It's an increasingly AI-driven industry. Obviously, Siemens, high-tech company, developing solutions. How does that fit in? How do we maintain the human connection, in an industry while preparing workers for a technology-augmented future?
Let me just first say that the idea of leading with your heart is really about authenticity and really being able to bring your genuine self as a leader into the work that you do. And remember that as a leader, the most important thing we can do is remember the power of our words and the power of our actions. And each and every interaction and every conversation, always strive to demonstrate our heart and our love for one another. When I look back, a colleague of mine coined that phrase to me. The irony is, when he coined it, he didn't realize that in many ways, I'm kept alive every day by a medical device. And so I have actually a pacemaker, which at my age is, very uncommon. But I have sinus bradycardia, and I happen to have a pacemaker that was developed by Medtronic. I share that because, in many ways, it's one of the factors that when I was encouraged and in many ways asked to consider coming on to Siemens, not that it was Medtronic who built the pacemaker that keeps me alive, but I knew that it was imaging equipment, lab equipment, and also radiation therapy equipment that touches so many lives. And as somebody who used to be a hospital administrator, I've seen particularly the fact that diagnostic imaging equipment and technology plays such a pivotal role when it comes to disease diagnoses and allowing us to see a cure to so many diseases and so many challenges in our healthcare system, that it's been a wonderful opportunity. How it plays a role, though, to your point, is, look, at the end of the day, AI is critical, particularly in our healthcare system. When we think about AI, it's in so much of our medical devices. And in fact, it's so helpful when we think about precision medicine, and when we think about early detection, and when we think about helping our physicians and our clinicians do what they do best. But you can never take away the human element out of healthcare. It's why healthcare starts with an H, in my opinion. It's all about humanity. It's all about how we treat one another, how we care for one another. And so in healthcare, when we think about workforce development, we need to prepare individuals to understand AI. We need to prepare them to understand how you can leverage AI as a guided assistance in this work. But you can never substitute what it's like to have human touch, what it's like to be an intentional, active listener, what it's like to relate and as we were talking about earlier, have empathy for one another in our care process. And so for me, the most important thing in healthcare is still that we demonstrate that care and support for one another.
That's wonderful. I really love that, the folks you work with are taking the holistic view, K through 12 and then higher ed, compared with, okay, well, next year we're going to have a bunch of graduates. We better go out and do some recruiting, because that, longer term thing is something that other cultures in the world beyond America, I think, have been blessed with having a longer view on things. One of the things that I'd like to just ask about, I have some colleagues here at the University of Florida that have developed a field and a center for arts in medicine. And they're actually involved in, early work was like doctors writing prescriptions for artists to come to the bedsides of pediatric cancer patients and doing things. And they found that, when you're engaged in creativity, your blood oxygen goes up, and there's other benefits to having artists come to the hospital. And that can even reduce some of the need for painkillers and other things. Is that something that in your current worldview is widely known in the corporate and the medical world, or is that still something that's sort of just emerging on a university or arts side of things?
I think individuals that have a holistic sense of care understand the power of arts and the connection to medicine, understand the power of music and the connection to medicine, understand the power of pets and the connection to medicine. In fact, in my hospital administration days, we had an active program called Complementary and Art Therapy. And that program, to your exact point, Professor James, was 100% focused on art therapy, music therapy, pet therapy, Reiki, all these elements that really contribute to the healing of an individual. In fact, the biggest space all those programs were utilized in our hospital system was in our cancer center. When people are at that really tough time of life, Reiki and art and pet therapy and different therapies that we were allowing and bringing to them allowed patients to just kind of focus on something else while the treatment was happening. Allowed them to explore with their mind and their imagination that, yes, they're in active treatment. Yes, they have something really difficult happening, but there is other things to be happy about. And so 100%. Here's where I think in the US, we've gotten it wrong, though. You can't bill for those services, right, within our healthcare system. And so often we haven't harnessed the power of how that holistically is still to the benefit. And no one can ever argue the benefit to the mental health, which again, I know we don't have equity or parity there yet, still in 2025, but there's still great immense benefits. The final point I'll make is I love to see when I see universities understand that. In fact, when I served at a college in Pennsylvania, I'll never forget the time our administration, I was on the administration, but there were several in our administration that were looking to cut the art program. And I said to them, I said, we have all these healthcare programs. You're going to cut the art program. You're not even thinking about how the arts are part of healthcare. And the president looked at me and was like, what are you talking about? And so I said, just hold off. Let me see if I can find something here. And so I met with the chair. I asked the chair and the provost if they would go with me to the local VA and meet with the VA team. And, long story short, one meeting led to many meetings, and ultimately they ended up getting a federal grant that allows the art students from that college to now do art therapy with the VA patients and family members who are coming back from serving with PTSD and so many other challenges, but now are doing art therapy in the local community, taught by students. And guess what? Our whole system is benefiting because guess what? Costs have driven down in behavioral health. Emergency room visits go down from those things. And so, we need to be more thoughtful around these types of things. And for those who sit in different places right now in our world and want to talk about how education isn't relevant, look, here's the reality. Those types of things are so relevant. And we've got data to back it up. We have to just better tell the story.
Thank you.
Extending the conversation about education, we're facing everybody knows we're facing a huge shortage, right? So we're going to need over 200,000 nurses a year. I think the estimate is here in the U.S. and enrollments can't keep pace with that. Uh, you've worked in some really interesting roles, interacting with higher ed in healthcare technology, hospital administration. You must have thought, gee, if this whole system could be redesigned in this way, this would be really interesting and helpful. What are your thoughts on that?
Yeah, look, uh, the sheer fact is the United States, for quite some time, has just got it wrong when it comes to the health professions. When we look across the world, we need to be moving quickly to adopt the models of what we have in the United Kingdom and what we have in Germany and what we have in other parts of the world. I mean, to Professor James's point, other parts of our world understand that it starts earlier. Last summer I had the privilege and opportunity to represent Siemens at a global conference on apprenticeships, and the whole idea was how do you take and learn what we see there and bring it back to the U.S. and move more quickly to an apprenticeship degree option. Look, the reality of it is even in our own Department of Labor at the federal level, while we still don't have the right 100% approach to healthcare apprenticeships because they were built on the trades, we actually have made some great momentum. Last administration, phenomenal work by a dear friend of mine, the Deputy Secretary of the Department of Labor, Manny Lamar, who really was moving us in the right direction. And I'll actually say, even in this new administration, I remain hopeful because the nominee over the Department of Labor is actually a very thoughtful person when it comes to apprenticeships, and he actually comes from Florida and has been very vocal and very supportive of this movement. I do believe we in the U.S. have to move to an apprenticeship degree option. I'm not suggesting that replaces entirely the traditional route, but we need to have options for a student and options for an employer. And so my thoughts on this are simple. I love the work that's occurring out of Reach University's National Center of the Apprenticeship Degree. That work is critical. We need to get accreditors. We need to get the U.S. Department of Education. We need to get the licensing boards, and we need to move this. And if I were Secretary McMahon, if you want to do one thing right, slam dunk this. Find your way to wrestle this to the top, as she says she wants to do with the Department of Ed, and figure out how to make it happen. Because what we know about apprenticeships in healthcare globally is they create a stackable approach that ultimately leads to better retention and also better for our patients. And I'll give you a U.S. example that I love. And my friend Bridget Willey leads this area at the University of Wisconsin Health. She's an academic herself, and she built phenomenal career pathways from youth apprenticeships to experiential learning opportunities to apprenticeships. And she's created stackable approaches from MA to patient care tech to CNA to LPN to RN. She's created three, right now in the country, the first two. She's going to create more, but the first two apprenticeship degree programs in the country with her tech college. She's done it successfully with support from the program accreditors in nursing and in respiratory therapy. We've got to scale that. If we can scale that, we can learn, earn, and build a sustainable workforce. But we still have those barriers, and financial aid is a barrier because we have program accreditors who won't allow a student to be paid for clinical experience. And for our program accreditors out there, get with it. This is 2025. And if an employer wants to pay the student, who are you to say no? And so we've got to move on this. And I remain confident with the work that NCAD and others are doing, that hopefully we can continue to educate. And here's the message I want to share. Employers need to be loud and bold in this. They need to tell their academic partners and help their academic partners when the program accreditors or when others get difficult, be in the room with them, challenge them. Because 9 times out of 10, when the employer says it, it's a little harder to say no. And we've got to do our job. Lives are at stake.
Well put, well recommended. I'm so glad that you've connected and remain connected and shared these connections and the results that you've already seen, because so many of us in academia, we learned in a traditional model and we continue to grow more to look like us, when in fact a lot of us were born in the middle of the 20th century, and we're purporting to prepare and educate people for careers in the middle of the 21st century, in which we're like 2 or 3 generations behind what's really going on, except for perhaps experience and what one of our guests has called durable skills,
Mhm.
compared with specific technological skills and things of that sort. So, Geoffrey, what do you think, if we can form some more partnerships nationally between academics, and I know your focus is in healthcare areas, which all we all need. But what would be ways, in addition to being in the room, as you put it, with accreditors and others, that we can start to, move in the direction which is not only humanistic, but I think also essential for the, let's just say, life on Earth of the human species. Any recommendations or things you've thought of?
When I look at so much of just our overall accreditation process, it's lacked really that tie to industry. And 9 times out of 10, what I still find is academic institutions are so constrained to what the program accreditor says that it's not the academic institution who doesn't want to try. They're just afraid because if they do one thing wrong, they're going to get cited. I had this recent conversation with a program accreditor, with an employer in the room, on the whole clinical experience issue. And the program accreditor specifically said, well, it's not a standard, but it's a board policy that you can't pay a student. And the employer said, but you can't cite it if it's not a policy or if it's not a standard. And the program accreditor said, oh, yes, we can. Well, who gave them that power? At some point we've got to unpack here, because I'm a bit afraid that in some spaces we've given too much power to some people who are actually making the workforce crisis worse than it is. And I'm not suggesting that they're intentionally doing it, but maybe there's some fear or anxiety or something that they just want to hold to, and they're not allowing us to innovate and transform. And so I just want to ask people to really give that careful thought. To Jeff's point, the statistics aren't getting better. And I guess the question I pose to those people who are holding that old way of thinking is, what are you going to do when you walk into a hospital and you don't have a nurse or you don't have a doctor at the table when you most need it? Are you going to think back on your decision to hold back that student to have been paid and have them become the future nurse that could have been in the room with you? I think we need to really take that to heart. The other point I would make, though, is I think if you are a college or university leader and professor or academic, we need to all ask ourselves, what are we doing to create true strategic relationships with an employer? And on the employer side, we need to ask ourselves, what are we doing to not be transactional? Because far too often, I think it's been more transactional versus really been a heart-connected relationship. And I'll give you an example. When I was at my hospital system, our executive leadership team said to me, Geoffrey, our academic partnerships just aren't working. They're very transactional. But we don't know what to do about it. And I looked at them and said, well, what have you tried to do about it? And they said, well, we meet occasionally. I said, well, you can't meet occasionally. We need to have standing meetings. We need to have collaboratives. We need to be studying things together, researching things together. We need to be making sure the clinical experiences are the best that they can be. We need to have shared faculty, shared governance. And so we put forward some phenomenal initiatives. And guess what? Over time, we built simulation labs together and we went for federal grants together and we did such amazing work just because we knocked down those silos. And yet we literally sat right next to each other. And for all those years prior, that didn't happen. Now, it's not because of Geoffrey. It's because we simply brought people together and challenged that older way of thinking. We've got to make sure we're doing that. We don't have time anymore to do the more transactional. We have to have a willingness to view it on what's in the end game. And for healthcare, it's about our patients, but in other businesses, it's about our customers. We've got to be thinking about that. And we've got to really just want to try it. Try something different. Try something new. and be willing to learn, tweak it, and get right back in it.
Geoffrey, one of the whenever I hear transactional, my mind immediately goes to relational, right? A fundamentally, human connected type of relationship. And I know in your work that you help so many sophisticated AI powered solutions, distance distance solutions to bring people closer together in the workforce, even if they don't live in the same space, to solve the talent gap. What do you need to keep in mind as you develop these solutions that recognize patterns better than human beings can recognize them, that increase the effectiveness of outcomes? Are people, is there a way to train our workforce or in apprenticeships to keep the durable skills alive in the workforce while all of that improvement is going on? How are you guys thinking about that?
Whatever we do, regardless of whether it's apprenticeships, apprenticeship degree, or traditional pathway, we've got to have work-based learning incorporated. Far too often today in healthcare, we have clinicians come out of a program academically, and they just don't come with enough durable, or as I say, human skills. And a lot of people have thoughts on that, right? Some people want to say, well, that's academics' responsibility. I think it's a shared responsibility. So here's the reality. We've got a shortage in faculty, particularly in the health professions. They're doing the best that they can do with what they have. Oftentimes, they may not have the latest, greatest technology, state-of-the-art technology in their labs. They may be teaching very large classes. They may be teaching too many classes. We've got challenges there with the shortage. And then on the hospital side, on the health system side, we also have challenges. We don't have enough educators. We have people who sometimes are doing the job of working with the students who really don't want to do that, or are burdened or burnt out. And so we just have a lot of challenges there. And we have a lot of work to do there. There's responsibility on both sides. And I think that's where if we both come together and collaborate to find solutions, we can do it. And we don't need government to tell us how to do it. And we don't need government to tell us that education isn't important, because guess what? We would have no high quality healthcare if that's the case. And we would have communities that are truly further suffering than they already are if that was the case. And so what we do need is we need government to care about these issues. And so, for example, if you're sitting at the U.S. Department of Ed or the U.S. Department of Labor today, and you're not thinking about how to help solve for our faculty shortage in our health professions, I'm not sure why you're in those roles, because it's a real shortage and lives are at stake. If you're sitting here and not thinking about how important it is to find new ways to help fund innovative models that can help build a future-ready workforce in the allied health professions, in the nursing professions, in imaging, in lab, areas that don't oftentimes get as much attention because they may not drive as much revenue or volume into the healthcare system, but ultimately they are the big drivers of all aspects of care. I'm not sure why you're in those roles either. We've got to be more focused on this. And that's why I believe it takes an ecosystem where we've got to sit down together and we've got to be willing to break bread together. And we have to be willing to not get offended when people say this, but we've got to create a more work-based learning approach. Because when you look at the European models, when you look at, yes, they have their challenges too. I'm not sitting here and saying they don't, but their challenges are not to the same level as our challenges. And the final point I'll just make is, I think in the US, we've made this mistake of thinking so long now for several years that we could kind of recruit our way internationally out of it. We want to, essentially steal nurses and steal other health professionals from other countries and bring them here. I'm not arguing that those individuals may want to come here. I'm the son of an immigrant. For those that are immigrants, I love you. We love you. But what I am saying here is that is not sustainable. And so we need to think deeply about that, because here's the deal. We have people now wanting to leave the US to go to other countries to serve in healthcare. And there's many reasons why they may want to leave the US, but it may be some of the same reasons why some of the other people want to leave their countries as well. And so it's not a sustainable solution. And I also just want us to think deeply about that, because they need people to take care of their patients too. It's a global issue. And so my fear, particularly where we sit today, is we've also forgotten how global this issue is. It really requires a global approach. And as we, as the country where we sit today, become more so focused on just us as a country, we lose that understanding that this is a global issue. And we need a global workforce. We learned in COVID how bad that was. And yet we're back at it, where we're not funding those areas in the same way that what we really need to. And so I just want to remind people that that's going to come back to bite us. And we're going to be sitting here at some point fearful of what's next because of that.
Thanks, Geoffrey. I can't tell you what a comfort it is to talk to someone participating, from a company like Siemens, a bleeding edge technology company with a focus on the human dimension of healthcare, where it has to lay.
Yeah, Geoffrey, it's really heartening to see that you clearly have done a lot of thinking about these human issues, and at the same time see the value of advanced technology as not being antithetical to human values, but, it's value add, to use a business term, and augmenting our potential as a species. So I really do want to thank you and your comments about academia and industry, clinicians and professors and administrators working together. And as Jeff just said, we really would love to have you back, or maybe even organize something that we can bring our communities together to share a lot of the vision that you've articulated today. So it's great to meet you, and I salute you for your work, and go boldly.
Thank you so much. Thank you both for all that you do.
Thank you, Geoffrey. Thanks again for your time and your intelligence. Thank you to all of you out there listening today. This is the Job Ready Podcast, the EFA Podcast. You can find us at efa.io/Job Ready. I am Jeff the Purpose Guy.
I remain Professor James. And Geoffrey, our distinguished and beloved guest.
That's all we have time for today, everybody.
Sounds good.
All right. Thanks for joining us.
Be well, Geoffrey.
Take care.
Cheerio.